Their son, just 22 years old, Nicholas Dominici, died after he and 3 others were exposed to fentanyl. This according to court papers, which said the daycare that was entrusted with protecting them, the Vino Niño, actually was functioning as a secret stash house where fentanyl and heroin was prepared for distribution on a regular basis. Investigators even found a kilo-sized brick of fentanyl inside a closet of the daycare facility, in addition to other equipment used for drug smuggling. Gray Mendez was accused of calling her husband multiple times, allegedly to clear the drugs, while waiting before calling 911, even as the 4 very young children were severely overdosing. And by the time help arrived, it was too late for Nicholas. Right after this sentencing, Nicholas's parents spoke in an emotional press conference.
10. Columbus, Ohio. Columbus has been severely impacted by the drug crisis, especially in recent years, and the city is grappling with a high rate of drug overdoses. The opioid epidemic, including fentanyl use, has played a central role in the city's challenges. In 2020, Franklin County recorded over 500 overdose deaths, marking a significant increase in fatalities compared to previous years. Heroin use has been widespread in Columbus, contributing to the opioid crisis. However, many heroin users are now encountering fentanyl-laced heroin, which increases the risk of overdose. Fentanyl alone was responsible for over 70% of overdose deaths in Ohio, including in Columbus. 9. Louisville, Kentucky. Louisville has seen a significant rise in opioid overdoses, particularly driven by fentanyl. Methamphetamine use is also becoming more prevalent. Louisville struggles with poverty and insufficient addiction treatment resources that compound the crisis. A new first-of-its-kind tracker released in 2022 showed the devastating effects of the opioid epidemic across the country. It tracked the highest overdose death rates in areas with over 500,000 people. It was revealed that Jefferson County, Kentucky, which includes Louisville, was among the hardest hit areas. Between August 2023 and July 2024, there were 1,777 overdose deaths in Kentucky, with 496 deaths being in Jefferson County. 8. New Orleans, Louisiana. New Orleans faces significant challenges with fentanyl and methamphetamine abuse, leading to rising overdose deaths. Homelessness, poverty, and limited addiction treatment options add to the complexity of addressing the city's drug problems. There has been a noticeable increase in methamphetamine use in New Orleans in recent years. Methamphetamine is contributing to rising overdose fatalities, and many people are using both meth and opioids, which increases the risk of overdoses significantly. 7. Detroit, Michigan. Detroit has long struggled with heroin and fentanyl addiction, and recent years have seen a rise in methamphetamine use. The city's economic struggles and widespread poverty make it difficult for many residents to access treatment and support services. Heroin use, locally known as dog or the dog, remains prevalent in Detroit, with many individuals transitioning from prescription opioids to heroin or fentanyl as access to prescription painkillers has become more regulated. Over the past decade, more than 2,000 Detroiters have died from a drug overdose, with 364 deaths in 2019 alone. Of the 364 deaths, 86% involved an opioid, 76% involved a synthetic opioid such as fentanyl and tramadol, and 41% involved cocaine. 6. Indianapolis, Indiana. Indianapolis has experienced a spike in opioid overdoses, particularly fentanyl. Methamphetamine use is also increasing, and the city faces significant issues with addiction, mental health, and a lack of accessible treatment programs. In the first quarter of 2024, from January to March, Marion County, Indiana, where Indianapolis is located, saw 134 overdose deaths. Out of the 134 suspected overdose deaths, 133 cases had completed toxicology results by the time of this report. The top three most commonly found substances in the toxicology results were fentanyl, 74%, methamphetamine, 33%, cocaine, 32%. Between August 2023 and July 2024, there were 1,927 overdose deaths in Indiana, with 539 occurring in Marion County. 5. Cincinnati, Ohio. Like many other cities on this list, Cincinnati faces a fentanyl overdose crisis, with heroin and methamphetamine also playing major roles in overdose deaths. The opioid epidemic in Ohio has spread rapidly, and Cincinnati is one of the hardest-hit cities in the state. According to the most recent data, Cincinnati has experienced between 270 to 500 overdose deaths each year since 2020. 4. Chicago, Illinois. Chicago is struggling with high rates of opioid overdoses, especially from drugs such as heroin cut with fentanyl, alongside growing methamphetamine use. Drug violence and the city's complex gang issues also fuel the crisis, with struggles over drug turf. The high prevalence of drug trafficking contributes to the widespread availability of dangerous substances. Chicago's West Side community has one of the highest fatal and non-fatal opioid overdose rates in Illinois. Illinois Department of Public Health data shows that there were a total of 2,408 fatal and non-fatal opioid overdoses on Chicago's West Side in 2018, and a total of 2,568 fatal and non-fatal opioid overdoses in 2019. The vast majority of these deaths involved heroin and heroin mixed or tainted with fentanyl.
4 people are now confirmed dead, part of that mass overdose from drugs sold on Chicago's West Side. At least 10 others were hospitalized for overdoses yesterday. Neighbors suspect it was from a batch of fentanyl-laced heroin. Our own reporter, Dana Kozlov, witnessed one of those overdoses.
Hey, stay with me. Stay with me. Stay with me. Stay with me. Open your eyes.
Was reporting from East Garfield Park yesterday when this man collapsed in the middle of the street. Almost as shocking was that no one around would help him. Dana called 911 while others nearby just watched, even laughed.
He want to get here. That's Chris. Go. Hey, I'm gonna be like, it's
not funny.
Despite our efforts, we don't know that man's condition at this time.
According to the Illinois Department of Public Health, IDPH, from 2013 to 2022, synthetic opioid overdose deaths have increased by 3,341% in the state of Illinois. 3. San Francisco, California. San Francisco has been deeply impacted by the opioid crisis, particularly fentanyl. The city's homelessness issue intersects with substance abuse, contributing to widespread addiction in public spaces. The lack of sufficient mental health and addiction treatment facilities also exacerbates the problem. According to studies by the University of California, San Francisco, UCSF, smoking has replaced injecting as the most common way to consume fentanyl, mirroring national trends, resulting in an increased risk of fatal overdose from the residue that accumulates in smoking equipment. San Francisco reached an all-time high of 806 deaths in 2023, with 653 from fentanyl. The city's rate was more than double the national average, and San Francisco was ranked in the top 4 for overdose deaths among U.S. counties with more than 500,000 people. 2. Baltimore, Maryland. Baltimore has been battling a devastating opioid crisis, with fentanyl contributing to a large number of overdose deaths. The city faces high poverty rates, limited access to addiction treatment, and a lack of resources to combat the epidemic effectively. Overdose deaths in Maryland are largely concentrated in the central region of the state. In 2020, 59.77% of all overdose deaths occurred in Baltimore City with 1,028 deaths, and Baltimore County with 394 deaths. From 2017 to 2021, the average number of opioid-related deaths in Baltimore City was 866.2 per year. Additionally, according to the Maryland Department of Health Overdose Data Portal, in 2023, Baltimore City saw 1,043 drug and alcohol-related deaths, 921 of which were fentanyl-related. 1. Philadelphia, Pennsylvania. Philadelphia, particularly the Kensington neighborhood, is notorious for its high rates of heroin and fentanyl use. The opioid epidemic has led to soaring overdose deaths, and the city's socioeconomic challenges, including poverty and unemployment, have made recovery efforts difficult. In 2023, Philadelphia had a total of 1,315 overdose deaths, according to data from the Pennsylvania Department of Health. In addition, 79% of the 2023 overdose deaths in Philadelphia included fentanyl. One of the most common drugs in Philadelphia, particularly in the Kensington area, is fentanyl and xylazine. Fentanyl has replaced heroin as the most common drug involved in fatal overdoses and is often mixed with xylazine, locally known as tranq,